and good afternoon. It's Lauren Schimmel. I'm the Director of Healthcare here again for our last session for DoForms Mobile Transformation Day. This is the last session of the healthcare track, and thank you all for everyone who's hung out with us today. I think we've covered a lot of subjects, many different discussions regarding how DoForms is being utilized in the healthcare sector today. This session is going to be on our home healthcare solutions specifically. Now, while we'll be really focusing in on the home healthcare sector, if you are in the healthcare space, but maybe you're a physician or you have a dental practice, I think there'll be some really useful tips and tricks and tools that we'll talk about in this session. So hopefully it will apply to many different people. For those of you in the home healthcare sector, thank you for joining us. I'm so excited to present this solution to you. We've been working, in the home healthcare space for many, many years. We understand your business. We understand your business challenges, as well as how we can help. So I'm really excited to share with you our solutions today, and really get into this with you. So let's talk about home care. I'll go back a little bit and, just to set the stage for those of you who may not be so familiar with what DoForms is. We provide a tool to help you transition from paper-based form capture to digital form capture. And what do I mean by digital form capture? I mean the ability to fill out a form as if it was a paper form, but on a tablet or a mobile device. That could be a cell phone, it could be a laptop if your home care nurses have laptops with them. Any device that they have. We support BYOD environments, bring your own device, as well as the ability to give devices to your caregivers out in the field. So that's DoForms. We help you digitize the paper workflows, as well as automate a lot of different processes around those workflows. And I'll make the point right now, I often get asked, are you an electronic health record system, or are you a home healthcare software system? Well, we're definitely a home healthcare software system, but we are not getting into the business of the Medicare, Medicaid claims reimbursement process that all of these other EHRs are highly focused on. We really thrive in the other clinical and operational workflows that still exist just in doing the business of home care. That can be things like patient admissions, patient assessments, needing to do daily shift notes, daily visit notes, weekly timesheets for your home care aides, and all the other different types of reporting, consents, waivers that need to be filled out with your home care clients. So that's where we really step in and help bridge that gap to fill in some of these operational workflows. Now, home care is perfectly suited for DoForms for a key reason. You typically have a central office, and then you have hundreds or dozens or thousands, depending on your size, of caregivers out in the field. They are doing visits, they're meeting with their patients in their home, they're doing their job, and they're documenting every step of the way. Now, I read one study where for every minute of care in the home, there is an additional 48 minutes of paperwork. So it's almost a 1-to-1 ratio. So you can imagine the amount of documentation that has to go in the home care realm. This, of course, is to ensure you get reimbursed. So we help you do that documentation effectively so that you have all of that done, documented, ready to bill. Now, there's home care workers traveling all around in a centralized office. So you can imagine a paper-based process becoming incredibly cumbersome. And I've literally been in these agencies myself. I have seen the floor to ceiling stacks of paper. I have seen the rooms dedicated to filing cabinets. Literally, I've even helped one customer change her office lease because she could reduce her office space by about 50%. So by going digital, we'll talk about that in a little bit. But the paperwork is enormous and it's coming in from all over the place. And just to kind of put this in perspective, home care workers as a segment travel so much, they travel to the moon and back 17,462 times a year. That's the study. So that's crazy. The amount they're traveling, they're on the road, they're doing these visits, they're all over the place. And let's see, and if you calculate that, that means they drove 7.88 billion miles and made more than 718 million home care visits during a recent annual study. That is a lot of visits, that is a lot of paperwork, and that is a lot of things all over the place. So DoForms ideally just comes in and really can help any home care agency. We work with small agencies that are local, really just do community services, to national agencies that have operations all throughout the country, whether it be franchises or corporate governance. We can help any size home care agency get in front of this paper storm. And the reason being is DoForms is perfect for this environment. We are able to help you arm your remote worker with that tablet, with that device, so they can quickly do the mobile data capture they need and get it back to the office. No more driving paper back to the office at the end of the week, which of course you have to pay them to do. So now you eliminate that expense. Instead, they just hit submit on their app, boom, the paperwork's immediately transmitted. So there are estimated to be over 11,000 home care agencies in the United States alone. I will say DoForms is an international product. We support multiple languages, so this definitely applies to international home care or healthcare companies as well. This is just a study on the US. But they still rely on paper capture of things like timesheets, consents, and admission paperwork. And this is even if they have an EHR or a home care management system in place. Many of our customers have another software that they're using, but there are still gaps. There are still questionnaires that they have to get done on an annual basis. There are still consents that they have to do. There's still paper. As much as they think, they're 70% of the way there, we can help with those other 30% of the workflow processes in a really efficient way. So much so that sometimes there becomes a creep. You start doing more with DoForms than some of your other systems because it's so convenient and so easy to use. So why do our customers come to us? If you're here on this session today, if you're attending DoForms Day, you probably kind of have been thinking about this, but just to highlight it, you recognize the benefits of digital mobile capture. First things first, it's going to save your employees time. No more driving paper back to the office, no more postage, no more shipping. We're going to immediately be able to get information back to the office. So it lowers, of course, your travel reimbursement expense. And it also makes your caregivers' jobs a lot easier. And if there's anything you can do to improve their day, they're so busy, if there's anything you can do to make it a bit more efficient, that's going to be great for you. We all know that there is a caregiver shortage right now in the United States. And with the baby boomer demographic rapidly approaching, more and more requirements for in-home care services, there's a big gap. So employee retention is a huge issue in the industry right now. So anything you can do as a company to make your employees' work experience, as optimal as possible, that's good. It's good for so many reasons for your business. So we expedite, not only the information capture process, but that allows you to do things like payroll processing, claim reimbursement processing faster, improving employee satisfaction, making sure they get paid on time. And it improves the quality of patient care with instant access to information. I shared this story first thing this morning in one of our first sessions, but the ability to get access to documentation immediately is equally important to better patient care. So what do I mean by that? I mean that, one of our customers, they were filling out visit notes on paper. And these visit notes would be filled out and you wouldn't be able to see them until that Friday when the caregiver came back and dropped off their stack of paperwork for the week and said, all right, do payroll. Well, in those sheets of paper, there's critical information about the patient, their vital signs, whether or not they had seizures, whether or not they had issues with catheters, whether or not their IV properly administered. So much is contained in that paper form, but you're only seeing it once a week. So with DoForms, when we gave that customer the ability to send these forms in daily, their clinical management team was immediately notified if a change in status was happening with the patient, if something odd was going on, so that they could intervene much quicker. And in this particular case, it was pediatric patients. So you can imagine, their parents and all of those involved just really like to know that this instant alerting was enabled with this real-time access to information. So really jumping from paper to digital dramatically improves the quality of care provided. And we talked, it makes the home health care aide their jobs easier. It makes them more satisfied with their work. It's tech savvy, as more and more new care workers come in, they're going to be younger, they'll be more used to computers. Although I will say, I've had DoForms in the hands of, 70-year-old users, and it's easy enough for them. So it's all good. But then, of course, we can help you ensure accurate and complete documentation, which improves your reimbursement. We make sure that everything is there, it's well documented, well stated, and accurate. And, of course, the elephant in the room, we eliminate paper-based expenses. All that shipping, printing, faxing, buying carbon copy forms, all of that is eliminated with the DoForms application. Now, home care agencies, I've noticed, need a strategy. While they know the benefits, they know what they want to be doing, it's hard to get started. They're so ingrained in the paper processes. They've been using this for years. This is what they do. This is how it works. And in addition, compounding that is there's just a wide variance between the types of services each individual home care agency offers, reimbursement sources, state and local regulations, certain compliance requirements. And all of this makes it nearly impossible to create a one-size-fits-all solution for home care agencies. So what that means is that people are stuck with the paper. The paper works, paper does what they need, and they haven't been able to find anything that can get them out of that, paper storm, paper ditch. Well, DoForms comes in because we're not a one-size-fits-all solution. We are a rapidly deployable, highly configurable solution for home care agencies. Basically, it's as simple as send us your paper forms, we'll help you create them in our platform, and then boom, you have a custom mobile app that's exactly what your specific business needs. Doesn't matter if you're in California, Louisiana, or Maine, we can make sure that you are getting the paperwork you need done in the most effective way possible. And we're very simple to use, very easy to use. And this is another difference we have with some of the other home care management systems out there. They're stuck in a certain workflow. They have built and invested in a system where things have to be done a certain way. Very difficult to tailor and customize. Whereas DoForms kind of flips that, and we build a solution based on what you need, what your organization wants, how your forms look, such that when you deploy the solution, your caregivers already know how to use it. It's just like filling out the paper form. They're just using the tablet or a smartphone or a laptop. So we found that, agencies require a solution that's adaptable, easy to customize, affordable, easy to use, and reliable. And of course, there's another bullet there, it's secure. We'll talk about our HIPAA security aspects a little bit later in our presentation. Adaptable, yes, we can, customize anything. We can, rapidly change, make a modification to a form if a new regulation comes out. We're affordable. We understand cost constraints. And also we're not solely a healthcare product offering. DoForms has customers all around the world in many different types of businesses, whether it's construction or field service or real estate. And we're really able to offer our healthcare offering using the best of everything we know works in those industries, but also because we're not only needing healthcare, we're very affordable. We're very reasonable, based on other healthcare software solutions out there. And we're easy to use. We understand that in order for this to work, in order to effectively make the transition from paper, we have to be easier than paper, which is a challenge, but we're able to rise to that challenge. And of course, reliability. We have some of the largest healthcare organizations in the United States using our product. We have done millions and millions of forms, healthcare forms. We are industrial grade, we're proven, we are very reliable. And that is critical in the healthcare setting. So I'll just fix this real quick. So our strategy really has been, we will engage with home care companies, and they'll typically have, a pain point. They'll come to us and say, we are so tired of our home health care aides doing weekly timesheets on paper. Can we please digitize that? And so what typically starts is just, we just need one form, which we build, we get it deployed, you can test it, you're up and running in a matter of days. Then we get more follow-up saying, wow, we could use this in our human resources department, We could use this to do an employee referral program. We could do all of our caregiver training on DoForms. So it starts as we just need one form, quickly becomes a full-blown digital document management system for various service lines. So I say that to say, we literally can do anything that your organization needs from a paper workflow perspective. It's always great, I feel, from a strategy perspective, to start with one pain point. But then once you really understand the tools and how it works, and you get these applications in the hands of your caregivers, you see, oh my gosh, I can now do incident reports. I can do COVID screenings. I can do media waivers, HIPAA authorizations, physician orders, medication profiles. All of these forms can now be digitized and centralized. And it's an amazing application that really can just grow as your specific business needs it to. So then the question becomes itself, well, why? Why is this our strategy? Why does it work? And how do we do this? So let's start with the how. We offer a set of home healthcare forms. So we have a library of pre-built forms that you can take a look at. If they work for your business, great. You can deploy them on your app and you're up and running. If you want them customized or tweaked, it's easy to do. We offer a form building training class as a part of the sort of onboarding process. And we also have a team of mobile solutions consultants available that will help build forms for you. We just take a look at what your project is. We give you a scope of work and a professional services quote, and you approve that, and then we'll actually customize and build your app for you. We're able to do quick modifications. So if you need something changed, it's very easy to do and deploy that out throughout the entire organization, which is very unique. So some EHR systems out there, they are, months and years go into the development of these EHR systems such that you can't make quick changes. So one example being, we had one customer that wanted their EHR to change how it said patient name to client name. They thought that was nicer. It presented their business, more appropriately, how they viewed it. The EHR would charge them, several, thousands, like tens of thousands of dollars to make that one modification. With DoForms, we could do it in seconds. It's not a problem. We're so adaptable and so easily configurable that those types of changes are nothing to us. So we can quickly take care of things like that. It also relates to, maybe Medicare releases a new requirement. You have to have a new language in your, election and benefits form. We're able to push that new form out and we build it. It's about 30 minutes and boom, it's out in the field. So you're able to really quickly build new forms to meet these new requirements and also remove things that may no longer be applicable. We're compatible with any device, so no issue there. Android, Apple, laptops, whatever device is there, we're able to work with it. You build the forms once with our form builder, and it's going to render beautifully on any device you're using. It's no concern there. Whatever meets your organizational needs the best. You get unlimited forms, so you can build as many forms as you want. You're not limited. Like I said, you could start with one project, and then all of a sudden you're doing human resources and payrolls using it, and you have home health care, skilled nursing, all of your different service lines can start using DoForms, personal care services. So we're easily deployable to different groups. So depending on what group you want to have access to a certain set of forms, we can manage all of that for you, such that maybe the skilled nursing app in your company looks different than the home healthcare aids app in your company. They have access to different types of forms. And of course, robust permission controls, making sure that patient information is secured and people are only able to see what you want them to see. Now, in addition to the digital form, we also give you smart workflows. So we have the ability to securely forward forms for signature. So if you need to forward a form for electronic signature, you don't have to leave the DoForms platform. We have a whole integrated electronic signature workflow built in. We can even allow you to fill out forms across multiple parties if they need to. Maybe you fill out something and the physician fills out something and then the completed document is stored. So we have secure forwarding that involves all the stakeholders. Secure email, if you need to email copies of forms that contain personal health information, PHI, you can email forms using our secure email platform. Secure reporting, if you need to export data from DoForms in a secure manner, we have a secure report builder. And Of course, alerting, secure alerts. So let's say there's a change in patient status, or you want someone to be alerted if someone's having a seizure or their vital signs go, above a certain threshold. We can set those alerts within the form. So as it's submitted, boom, people are immediately notified. So all of these smart workflows and custom templates, that's really the how and how we build these products for our customers. And just, some examples of some of the pre-built templates we have in our home healthcare library: home health aid time and activity record, skilled nursing daily visit note, admission packets, huge. These are multi-page packets with many consent forms when you admit a new patient. Your HIPAA consent, your media waiver, incident reports, physician's orders, medication administration record, intake, service consents, your handbook, your policies, your training. The list really goes on and on and on. We've worked all across the country with all sorts of home care companies. So we have a lot of templates that have been authorized to be able to be shared, but you're able to use those, and you can either use them or start from scratch. And we build based on what your exact workflow requirements are. Now, this is really important. I do want to touch on this, our security features around our platform. We take HIPAA very seriously in our company. Our tools, our advanced security feature set, which is required for healthcare organizations, ensure that personal health information, all data is encrypted. We actually do this with the form builder itself. When you build a form, we ensure any field that's going to contain PHI is encrypted. And that is encrypted on the mobile device and in the cloud. So only those with authorized permissions to view decrypted data can view it. We have multi-factor authentication. So it's the same as if you're logging into your bank account and they send you a code before you can get in. We have MFA around our portal, as well as on the device, to make sure that only those authorized devices, their ID, can access your account. If a different ID, a device ID, tries to access an account, it's going to lock it for everyone. So we have MFA on the device as well. And we also have all sorts of other settings, such as PIN-based login, inactivity timeout, user permission controls. The list goes on, as well as we will sign a business associate agreement. If you do reach out, we'll look at your system, look at your structure, or just get you started to make sure you're building your platform the right way. And then we would happily sign a business associate agreement with your company. So we provide a secure platform for sharing forms with PHI externally to doctors, insurance companies, and others. And we also utilize third-party consultants to audit our internal policies and procedures. So internally at DoForms, we take HIPAA compliance very seriously. We have all of our employees undergo annual HIPAA training. We have robust policies and procedures in place. We have all of the different risk assessments, security assessments undergone on an annual basis. So not only do we offer a HIPAA compliant product, we ensure that our company ourselves are operating in a HIPAA compliant manner. Now, this is just a quick view as to what a custom mobile app could look like for your home care company. You'll see, all of this is completely customizable. The logo, the icons, the look and feel, the branding, and the form itself. We build it so it is exactly what your organization needs. And again, as your home care workers travel to the moon and back 17,462 times a year, we can give them a tech-savvy, space-ready solution for them to do their mobile data capture. And it's very important to talk about our ability to do integration. We can integrate with your home healthcare management system. So if you have a system in place and you maybe want us to pull over patient demographic information into our forms so that patient lists become a drop-down, or if upon submission you want to store a PDF in a patient chart, we do offer integration. And we utilize HL7 specifications in order to do that, which is the leading data specification and integration engine for communication and patient information between healthcare systems. So we do have the ability to do integration, which is a common question we get asked. While we have some out-of-the-box integrations with healthcare offerings, just talk to us. My email will be present at the end of this presentation, and we can talk about whether or not custom integration is a fit for you and what that would look like. So let's talk a little bit too about some of the other features besides just our smart forms. We also have a GPS engine functioning behind the scenes with DoForms. So we have device-based GPS tracking, which allows us to use any type of device and make it a GPS tracking device. So as your caregivers travel around and do their visits, we can track their exact location. We can automatically calculate mileage as they travel around. We can see exactly where they're doing their visits for visit verification. And we're even smart enough to send you alerts if they're doing a visit and saying they're at a certain location, but they're really not. So we have a little policing control there as well. We can automatically detect when your device is moving or stop moving. We can do a breadcrumb trail documenting speed, direction, and distance traveled with each point on the map. So you can kind of look and do some route optimization and see exactly how far your caregivers are traveling on a given day. And we document, all sorts of things. What's awesome is, maybe someone calls and you have a new referral, you can actually look on the map and see who's the closest person there, give them a call and ask them to do a visit. And we can also send back real-time status alerts to the main office so you can kind of see how visits are going. We did have a session earlier today, and I'd encourage you, if you weren't able to attend, to take a look at our caregiver self-scheduling solution. So this actually allows a caregiver to set their schedule for the day, and when they arrive at visits, confirm that they're at the visit, whether or not it was a successful visit or they have to reschedule or come back another time. And all the while, they can transmit in real-time status back to the main office. So you get that visibility as to how the caregiver's day is going and get that visibility into that scenario. And this, of course, with GPS also helps from a compliance perspective with things like the electronic visit verification mandate. So we're able to verify, the GPS location of the visit. Not only do we document that in our documentation, but we also have the ability to launch EVV applications from within DoForms. So let's say your agency is using one of the state, apps for EVV. You can actually embed that in a timesheet in DoForms and open it up, clock in an EVV, but also go back immediately into DoForms so that you can get all the other visit documentation that you need for compliance purposes, signatures, tasks completed, all of the charting, vital signs capture, get that done, and then you've now done both. So it's a one-stop workflow to help you do the visit verification and visit documentation in one platform. We also have reporting, which of course is important. After you capture all of this data, you might need to do things like payroll. So we can actually automate a payroll report that will basically take a look at all of the visits throughout a week, start time, end time, the total time, and you get a nice report for each caregiver automatically sent to you at a scheduled time. So first thing Tuesday morning, that report's sitting there on your desk. And you can use this for all sorts of different types of reporting. Maybe number of new patients, number of patients having seizures, number of patients who are hospitalized, new physician's orders, whatever type of analytics you're looking to get from your information, you can use our secure reporting feature to build those reports into your system as well. And we can certainly help you do that. So all of these tools are great. And, for our partners out there, for our home care companies that are kind of learning, how do I get started or what do I do? It could be overwhelming, and we understand that. We've been through the process so many times, and we're here to help. So typically what will happen is we'll, meet together and we'll identify what your pain point is. What paper process is really driving you, crazy right now? Is it admissions? Is it intake? Is it, the home health aid timesheets? And then what we'll do is we'll design a prototype for you. You send us what you're doing today on paper, and we'll help you with the prototype development. And then you can test it out and you can see how it goes. We'll provide you a demonstration before you get started so you can flesh out if there are any changes that you need made. And then, you can try it out. So then, you can get a trial period, and from that, we'll get your feedback, we can make modifications, and then, you like it, we can do system deployment. And we also have various levels of support available. If you need help building training documentation, actually doing training for your end users, we have all sorts of services that can be available as needed. So again, we have a strategy for you. We make it easy. We have the expertise. We have a team here willing to help you. So please, reach out and utilize us. We're here to help. And just to, have a few, use case references in the back of your mind. Again, I talked about reliability. Nobody likes to experiment in healthcare. You want to use proven systems. So we've worked with companies like Beata Home Healthcare. They have over 16,000 caregivers who provide, care to 7,000 pediatric patients across the country. What we're able to do is put tablets in the home of these patients, and then the caregivers come and do their documentation through these tablets and submit it back to the portal. So there's actually millions of forms being done annually and used for audits, payrolls, and payment. And in addition, family members are able to log into the tablets and see what's gone on throughout the day for their child. So it's really great to kind of open up the documentation process, so it's no longer just between the agency, the caregiver and the agency, but the family can actually get involved and see what's going on. And in fact, this deployment was really interesting because they wanted this for their pediatric group, which would typically end at about the age of 18. But it was such a success, those who graduated from pediatrics still wanted to keep the tablet because the family really liked having that visibility into what was going on. And another use case is with the Visiting Nurse Association of New Jersey. And again, I'm just sharing some stories just so you can understand, how adaptable DoForms is, how we can meet, various different requirements. So at the Visiting Nurse Association of New Jersey, we're not doing visit notes, but we are handling their hospice admission process, which requires them to be able to fill out an admission package for the hospice intake. And then once it's completed, we're able to send forms like the Do Not Resuscitate form securely to a physician for signature. And also we're able to print admission paperwork on demand using our integration with full-page mobile printers. So that's a really neat add-in that we have. With VNAHG, we also have caregiver daily scheduling solutions. So I talked earlier about the ability to have a clinician self-schedule themselves. So what that'll do is they'll report in what they expect their visits to be the next day, submit it, and we have designed a very nice calendar where you can log in and actually see where everyone's supposed to be on a given day. And that is a readily available solution if you're interested in self-scheduling. We also worked with VNAHG to develop a COVID-19 screening tool. So we're monitoring all of their care workers for symptoms of COVID-19 and working on their referral process for services. So if they encounter a patient who might need services, we have a whole referral form process. So again, saying, we're not your traditional EHR, but we are a platform for these clinical and operational workflow requirements that show up. And here's a quote from Dr. Rosati at VNAHG, who was our director of quality there, saying, the DoForms platform is an ideal solution to quickly design and implement a critical mobile application without significant development time. It was done in a few hours and we were receiving real-time health information from our employees instantly. So that's amazing. So in this case, this was right at the beginning of the COVID-19 pandemic. We received a call saying we have to have a tool to be able to screen our employees before they do in-home visits. So we were able to design, within a matter of hours, a COVID-19 screening solution, and it was deployed to thousands of workers out in the field. So we really can help healthcare organizations with quick response, be very adaptable, and design these workflows without months and months of arduous development time. And of course, a lot of resources that go along with months and months of development time. So in home healthcare, again, I talked about we are traveling, all thousands of miles, millions of miles, billions of miles a year, and we really work great in the home healthcare sector. But that's not to say we are not also present in other healthcare areas. So we work in hospice, we work in behavioral health services, helping with doing progress notes and treatment plans for children and adults with, behavioral health, that require behavioral health services. We work in dental practices for intake, physician and family medicine, intake, demographic, patient SOAP notes, physical therapy, we do progress note tracking, speech therapy, again, all of the consents and tracking that goes on with speech therapy services, substance abuse programs, drug therapy, rehab centers, mental health services, complex pediatric care. We do laboratories, surgical equipment, mobile healthcare delivery. You know, all sorts of different healthcare organizations come to DoForms looking for HIPAA compliant, secure, affordable, effective mobile data capture solutions. And we really are here to help. So I do hope that, you know, that had some value to you, just kind of understanding the landscape of what we offer. If you are in the home healthcare sector, please, I'm going to pull up my email address right now. Send me one paper form that you're using. We'd be happy to put together a custom demonstration for you. Give us about 15, 30 minutes of your time, and we can work with you and determine the ROI, really help you save money this year. And, you know, as the pandemic taught us, going digital is critical right now. You need to have that anytime, anywhere access to information. You need to be able to deal with, you know, contactless signature, digital workflows. And so DoForms is a really ideal fit for you in that area as well. So I'll just pause and see if there are any questions. Let's see. Okay, there's one question talking about business associate agreements. Yes, you may have missed it, but we will sign a business associate agreement. We will need to take a look at your account, or if you're just getting it set up, we'll make sure that you are, you know, setting it up appropriately. But yes, that is something we do offer. So that's not a problem at all. And then the second question had to do with secure forward. Okay. Does it replace, okay, so this is a question asking if it replaces other services for electronic signature. And yes, so with DoForms, you actually get a one-stop shop. So you can do digital forms capture from, you know, you fill out your form on your tablet, it goes back to the portal, but you can also forward forms to signatures. So you don't have to be a licensed DoForms user to sign a document. What you'll do is you'll forward a form for signature, and as soon as that signature is received back, you'll get a signed copy. So it does replace the need for other services that do electronic signatures, and it's all included in our platform. So you get access to our secure forward credit model to be able to do that process. So yeah, great question. But yeah, you don't have to leave DoForms to do the electronic signature process. It's all unified. All right. Well, yeah, please keep the questions coming. Anything else, you know, I'll follow up with you via email. My email address is on the screen. I please encourage you to reach out. Happy to have a conversation, brainstorm with you, figure out how we can be of assistance. And again, you know, just want to say thank you to everyone for joining us for our first Transformation Day. I wanted to give a special shout out to my colleague, Lauren Collis, who's been here all day helping me out from a tech perspective. She's one of our rockstar mobile solutions consultants. So thank you, Lauren. And thank you, everyone. Hope you have a wonderful rest of your day. And I really look forward to hearing from you. So please email me anytime. Thank you.